Good afternoon, everyone. So we'll be discussing today lesson number 10, handling and processing of non-blood specimens for laboratory testing. So the previous lesson, it's for blood specimens. Ito naman is for non-blood specimens. So let's proceed. So first, ano yung non-blood specimen? Na pinaka-common na nare-receive natin sa laboratory, we have the urine. It is the most analyzed among the non-body fluids in the body. So urine analysis provides a picture of many metabolic functions of the body. It helps monitor wellness, helps in diagnosing and treating UTI, helps in detecting and monitoring the progress of treatment in metabolic diseases, and it helps in identifying the effectiveness of an administered therapy. So yung accuracy of urine analysis result depends on several factors. We have collection method, container use, transportation, and timeliness of the testing. So first, ano yung common urine test? We have the routine urinalysis. It is the frequently ordered urine test that screens patients for urinary or systemic disorders. Before, na-discuss na natin na meron nga 3 parts, yung urine analysis. We have the physical, ano yung sa physical, color, clarity, and odor. Yung odor, hindi na siya tinetest ngayon. Next, we have chemical. Yan yung it's either 4 or 10 chemical analytes. Tapos lastly, we have the microscopic. Ano dapat yung specimen pag routine urinalysis? We have midstream, clean catch collection. Bakit? To ensure that there is no contamination. Tapos, the specimen container should be clear and dry. Tapos, it should be transported to the lab within ilan? 2 hours. Next, we have urine culture and sensitivity. Class itong urine and culture and sensitivity, hindi siya dinadala sa clinical microscopy. Dinadala siya sa bacteriology or microbiology kasi doon ginagawa yung culture and sensitivity. So it is requested if the patient has a symptom of UTI. So ulit lang, dapat laging midstream clean catch yung urine. Tapos kinukulture siya within 18 to 24 hours. So the medium will encourage the growth of microbes. Tapos pag if microbe is present and identified, dun mo na siya isa-sensitivity or antibiotic susceptibility test. Anong ginagawa sa antibiotic susceptibility test? So parang meron siyang maliliit na pabilog siya na candy. Para mangyari class dyan, nasa plate, yun. Tapos nandito yung specimen mo. Tapos lalagyan mo dyan ng parang maliliit na candy siya. Ano yun? Yun yung mga antibiotic. Tapos, once na magkaroon ng zone of inhibition or yung parang nagkaroon ng bilog, nag-clear yung within dun sa antibiotic, ibig sabihin, pwede siyang gamitin as antibiotic para malabanan yung UTI or para ma-cure yung UTI dun sa patient. Next, we have urine cytology studies. So it detects cancer, cytomegalovirus, and other viral and inflammatory diseases. So ito dapat in-examine immediately. Tapos ulit dapat ang specimen is clean catch specimen. Next, we have urine drug testing. Para saan to? To elicit use of recreational drugs, use of anabolic steroids to enhance performance in sports, and unwarranted use of prescription drugs. So random sample is placed in a chemically clean container with lid and submitted for testing. We also have urine glucose and ketone testing. So it performed to screen diabetes and to determine the glucose level per patients who are already diabetic. Yung urine ketone level test naman is to determine if the patient is suffering sa diabetic ketoacidosis. So itong dalawang to kasama na siya dun sa strip, dun sa 10 analytes sa reagent strip. Ito common sa mga babae, sa mga yung mga pregnant, urine pregnancy testing. It is used to confirm pregnancies which can be detected 8 to 10 days after the conception. So anong dapat sample dyan? We have first morning urine specimen. So other urine tests, meron tayong electrophoresis, heavy metals, myoglobin clearance, creatinine clearance, at saka porphyrins. So what are the types of urine specimens? We have random. It is collected anytime. Pag first morning, ibig sabihin yung unang ihi mo sa umaga, after mo gumising, 8-hour urine sample. Tapos pag fasting naman, anong ginagamit na urine? Second morning or second specimen voided after fasting. Pag type naman, yun yung merong mga oras. Pag tolerance test glucose, meron siya fasting after 1/2 hour and after 1 hour. Pag 2 hour postprandial, 2 hours after meal, 24 hour, yung lahat nung ihi mo sa loob ng 24 hours, kokolektahin mo lahat, ilalagay mo sa isang container. Tapos double voided, waiting time of approximately 30 minutes after emptying the bladder. Ito yung 24-hour urine collection procedure. Ang unang ginagawa, i-empty mo the bladder upon waking up. So yung pinakauna mong ihi sa umaga, hindi mo yun isasama. Bakit? Kasi yun pa yung, kumbaga, natira mong ihi nung the following day, nung nakarang araw. So magsisimula ka dun sa pinaka unang ihi mo para sa araw na yun. So affix the label on the container and write down the time and date of the specimen, start timing, discard line output at first hour of collection, and collect all the urine that has been passed for the next 24 hours. Tapos, nire-refrigerate yan. Tapos, drink fluid as needed to avoid dehydration. Tapos, take one last void at the end of the 24-hour collection period. So, make sure that the container is sealed before placing it in the cooler. Transport the specimen to the lab as soon as possible. So, ulit lang to, urine collection methods. We have regular voided, the patient voids or urinates into a clean container. Midstream, the patient voids or urinate into the toilet first, interrupt the urination for a while, then restarts into the container with the last urine flow voided in the toilet. Midstream, clean catch naman. Special cleaning is performed on the genital area of the patient before collection. Catheterized urine of patient is collected from a sterile catheter inserted through the urethra into the bladder. We also have suprapubic. Ano tong suprapubic? Ito yung tinutusok yung mismong urinary bladder. So, inserting needle directly into the bladder and aspirating the urine by use of sterile syringe. Pag pediatric, ito naman yung mga merong wee bag na tinatawag. Tapos it is checked every 15 minutes until required volume is collected. So next we have amniotic fluid. So ano yung amniotic fluid? It is a clear, colorless, pale yellow liquid contained in the amniotic sac that surrounds and cushions the fetus during pregnancy. So it is collected by a physician using a trans-abdominal amniocentesis, preferably 15 weeks of gestation. So paano to kinokolek? It is guided with an ultrasound machine and about 10 ml of fluid is aspirated. Bakit to ginagawa? It is used or it is done to detect genetic disorder, check any problem in the fetal development, and verify the gestational age. Ang CSF naman, cerebrospinal fluid, it refers to the fluid that surrounds the brain and spinal cord. It is a clear and colorless, obtained by the physician using a lumbar puncture or spinal tap. Bakit nagko-collect ng CSF? It is used to diagnose meningitis, brain abscess, CNS cancer, and multiple sclerosis. So, collected in 3 special sterile tubes. Ang una, saan dinadala yung tube? Sa chemistry and immunology test. Yung second tube ay sa microbiological studies. And third tube ay sa cell count. Saan tong cell count? Sa hematology. Tapos dapat nasa room temp lang yung specimen. We also have gastric fluid or gastric analysis. It is used to check the contents of the stomach for abnormal substances and evaluate the production of acid. So the sample is aspirated to determine the acidity before stimulation. So merong gastric stimulant is administered IV after the specimen collection. So a series of collection will follow with time intervals. So lahat naman yan class ay kailangan nakaplace sa sterile containers. We also have nasopharyngeal secretions. It is collected and cultured to determine the presence of bacteria that cause diphtheria, meningitis, pertussis, or the whooping cough and pneumonia. So the collection is performed by gently inserting a dacron or sterile cotton tip flexible wire swab through the nose and into the nasopharynx. Kung napapanood nyo yung collection for COVID-19, ganito po yung nasopharyngeal. Dinadaan sa nose yung swab or yung para siyang cotton buds pero yung isang dulo lang yung merong cotton hanggang sa makadating sa nasopharynx. Tapos yung specimen na yun yung gagamitin to detect kung meron ka nga bang COVID or wala. Saliva. So it is used to check the hormone levels, determine alcohol, and drug or substance abuse. So it is dapat siya ay frozen to ensure stability prior to delivery sa clinical laboratory. We have semen. It is a thick yellowish white fluid that contains sperm released during ejaculation. Bakit nagpapatest ng seminal analysis sa mga lalaki? To evaluate the fertility, assess the effectiveness of sterilization after vasectomy procedure. Ginagawa din to for forensic or legal reasons such as sexual assault, yung mga rape, ganun. Tapos, it is placed in a sterile container. Dapat ito ay kept warm, protected from light. Serous fluid naman, it is found between the membrane that encloses the pleural, pericardial, and peritoneal cavities. Anong kulay niya? Pale yellow. At its main function is to allow the membranes to pass through each other with minimal friction. So, effusion or increase in volume. Pag nag-increase ang volume ng serous fluid, it indicates inflammation, infection, or decrease in serum protein level. So, ang EDTA tube, syempre saan niya dinadala for hematology, cell count, at saka smear. Heparin naman, for chemistry, non-anticoagulated tube for biochemical tests, heparinase for blood cultures. So type of fluid should be indicated on the following. Pag pleural fluid sa lungs yun, peritoneal sa abdominal cavity, and pericardial sa heart. Sputum, we have the sputum. It is used to diagnose and monitor lower respiratory tract infections like tuberculosis. Ang pinaka-common na pinagagamitan ng sputum as specimen ay para to detect tuberculosis. So, anong ginagawa dyan? Collection is done first thing in the morning. Since larger volume has accumulated overnight, tapos at least 1 hour after meal. To avoid gagging. So, patients should gargle with water and remove dentures if any, and should take 3 to 4 deep breaths, inhale and exhale, cough forcefully on the last breath, and expectorate and expel sputum in the sterile container. So, ano dapat volume? It's 3 to 5 ml. Sweat naman, it is used to analyze chloride content in the patients under the age of 20 with symptoms of cystic fibrosis. It is an exocrine gland disorder. So, ano yung sweat chloride test? Anong tawag? Iontophoresis. It is used to transport pilocarpine or sweat-stimulating drug into the skin. Tapos, yung sweat, kinokollect, tinitimbang. Tapos, yung chloride content, ina-analyze. So, it can also be used to determine illegal use of drug by placing patches on the skin for an extended period of time, which is further confirmed by subsequent drug testing. Synovial fluid. Saan niya makikita sa mga joints, movable joints. It is used to determine conditions such as arthritis, gout, and other inflammatory conditions. So it is collected in 3 tubes. We have EDTA heparin for cell counts, identification of crystals, and smear preparation. Sterile naman for culture and sensitivity, and non-additive for macroscopic appearance, chemistry, immunology tests, and observing the clot formation. Buccal or cheek swab, para saan yan? Mahalaga lang dyan is for DNA analysis. Bone marrow, it is used to identify blood diseases. So the physician inserts a large gauge needle into the sternum or the iliac crest sa hip bone and aspirates 1 to 1.5 ml of specimen. Breath samples or the urea breath test or the CUBT. It is used to check the presence of Helicobacter pylori, which is a bacteria that damages the stomach lining. So after baseline breath sample is collected, the patient is asked to drink a special substance that has synthetic urea, then asked to breathe into a mylar balloon at specified intervals. So breath specimens are analyzed for carbon-13, which confirms the presence of H. pylori. We also have the hydrogen breath test. It helps in the detection of carbohydrate digestion problems such as lactose and fructose. It detects bacterial overgrowth in the small intestine. So ano yung preparation? The patient must take antibiotics 2 weeks prior to their scheduled test, should not eat certain food for 24 hours, and smoking and exercise are also restricted 30 minutes before the test. So feces naman, or the stool, it is used to determine gastrointestinal disorder, analyze the presence of intestinal ova and parasite. Ito yung pinaka-common kung bakit nagko-collect ng feces. Baka merong parasitic infection. Be cultured, then examined for the presence of pathogenic bacteria and viruses. Check fat and urobilinogen content. At saka used to test for the presence of blood sa feces or stool. So the hair, it is used to analyze trace and heavy metals used to detect chronic drug users. Bakit ang hair ang ginagamit? Because it is easy to obtain and not easy to alter or tamper. We also have throat swabs. It is used to aid for the streptococcal infection detection. So, pwede nyong makita yung procedure sa page 126 ng book nyo. Anong ginagamit? Sterile polyester tip swab. Tapos, tissue specimens naman para sa biopsy. So, the tissue sample should not be placed in a formalin. The phlebotomy should check the proper handling procedures, particularly if the specimen delivered is not immersed in a solution.